I'm Ben Ryman, and this is Behavior Speak. In episode 139, I chat with the brilliant and wonderful Sawsan Razzouk, a Lebanese psychologist who elegantly melds applied behavior analysis, acceptance and commitment training, and EMDR therapy to address the effects of war. Sawsan has experienced the trauma of war from the time she lay in her mother's womb as they fled wartime Liberia in the late 1980s. Now working to support families in the West Bank, refugees escaping to Lebanon, and therapists on the front lines, Sawsan and her colleagues are using what little resources they have available to them to effect change and build resilience for all affected by the horrors of war. Welcome to the podcast, Sawsan.
Thank you. I'm happy to be here.
Before we get started, I just want to acknowledge and produce this podcast on the stolen lands of the Clegos, Komoko, Klaaman, and Comox First Nations. Grateful to be here. So, Sawsan, tell me about yourself.
So, my name is Sawsan Razzouk. I am Lebanese. I was actually born in Monrovia, Liberia, in West Africa. Our family had to flee there at different times because of the war in Lebanon. So, I didn't necessarily grow up there because war erupted there. So I grew up in Lebanon. My first language was Arabic, but most of my studies was in English. I studied general psychology in undergrad at the American University of Beirut, and I realized that I appreciated clinical psychology and social psychology the most. So when I wanted to pursue my master's education, I went to Columbia University in New York. At Teachers College, I got my master's in clinical psychology. However, it was part theoretical, so when I graduated, I realized I needed more training. So I got trained in ABA, and I started practicing, thinking it would be just a stepping stone. And then I fell in love with ABA, fell in love with working with children. Eventually, I started working with all ages. Originally, my practicum was with geriatric population, actually. And I pursued ABA. I continued with a verified course sequence. I studied at UCLA, UCSD, and the Chicago School of Professional Psychology to get the courses needed to sit on my BCBA exam, which I did and I passed. And then I realized that ABA may not be enough. Started learning from autism self-advocates how their experience of ABA was, and it was extremely difficult for me to hear some stories about how some people experience it as traumatizing. And I started trying to change, and what I call myself a progressive behavior analyst. So I tried, and every single day make a decision to be, person-centered, culturally responsive, and trauma-informed in my work. But I realized that it's important to know other strategies as well, because I was interested in working with not just special ed and neurodivergent population. I was interested in working with just back where I started with everything in the clinical psychology side of things. So I got trained in acceptance and commitment therapy, as well as a bunch of other therapies, but that is like the most one that I frequently rely on. And I also got trained in something called eye movement desensitization and reprocessing therapy, EMDR, which is famously known for trauma therapy, but also can be applied for a variety of mental health conditions. So for around 11, 12 years straight, I worked in ABA and special ed, school inclusion. I was part of the revolution, and I would call it, in the UAE, with ABA becoming so popular, as well as inclusion in schools. I used to do a lot of community engagement, community training, being bilingual. And I loved it all, but I really now am moving more into the direction of doing therapy for people who have trauma, for so on. And I combine behavior analysis, ACT, and EMDR. And I found it to be absolutely brilliant. So there are proper trainings on how to mix ACT with EMDR or ABA and other therapies. But I learned each separately. And next for me is trying to just continue enriching my skill set. And each of my clients, I learned something new from them. And I'm trying my best to also, so enhance my skills. So I make sure I can be the best therapist I can be. So I'm pursuing further certifications, licensure in different things.
Trauma seems to be something that's been a part of your life from the very beginning. There's something you said at the very beginning that kind of where you started. So you said you started in Liberia.
Yeah.
And so tell me about Liberia and why you had to flee at such a young age.
So I'm the youngest of 5 siblings for 5 children, and when I was born, a year later, the war in Liberia erupted. So I remember that my father had to stay back because in the past, when he had fled with us, he lost everything, the warehouse, the business, everything. We have an electronics store there.
And so was this like an internal war, or were they war with somebody else? Or?
Yeah, so there was the rebels and against the government. So there was an internal conflict. It's a civil unrest, I think, if you have to put a label on it.
Sure.
I can't actually remember. There were several wars. So I can't remember with the 89 which one it was. Right. But war has been part even when I was in my mother's stomach. Like there's, if you want to look at epigenetics and all of that, like, even when I was in my mom's stomach, she was in Lebanon at first. There was war there, and there was that civil war. It was definitely part of my I think my story. But I was just 1 year old, and we had to all flee, and we had to separate from my father, which is quite distressing for my mother and my siblings. I, of course, didn't understand anything what was happening. But we went to the north of Lebanon, where we are originally from. And then because there was war in Lebanon, in Beirut, so we had to go to the north. So there was less options for us. So as soon as the things settled a little bit, we went to a city in the north rather than the village we were from. So we're kind of always on the move. And then when we grew up a little bit, things settled, the war ended. We're still being occupied by Israel. Some areas were occupied by Israel. We were still considered to be at war, but there was no more active battle or anything. So we moved to Beirut at that time for our education. And I mean, it's very sad to say that I grew up watching explosions from the window. Like it was, we were far, we were in a safe area, thank God. But I thought it was normal. I thought everyone experienced it. I didn't know any different, you know. And then in 2000, when the Israeli occupation forces, they withdrew from the south of Lebanon, and the war, quote unquote, ended. Like it was amazing. I remember even as a child, I knew how monumentous this was. And then there was, unfortunately, we were unofficially kind of occupied by Syria. No one would actually kind of talk about it because it's extremely uncomfortable, because we love Syria. Look at the politics of things, like we were never really truly independent. And then in 2005, there was this major assassination that happened in Lebanon. And it is very vivid to me because we heard it back when we were in school, and they assassinated our prime minister. And I remember even as a 16-year-old, I was 16. 2005, I remember that was my first protest. We went down and we all protested against what was happening. And the talk, like the words like trauma and things like that, were always thrown around like so normal. Like it was as if someone, you know how nowadays we talk about, stress or burnout. That is how the word trauma was thrown around. Like, people are traumatized or they have shell shock. And like it was so common that it felt normal almost. So I think that's what drew me to psychology. And I'm not the only one between my sisters who studied psychology. 4 of us studied psychology.
Gosh.
My brother was the only one who went into business straight out of the bat.
And are your sisters still in the field?
One is she continued till she got her PsyD. She practices in the US as a clinical psychologist, and you know, she's a mentor to me and my idol because she's amazing with her trauma work. But no, my other sister went and used her psychology for business, and she went into corporate world. So she business psychology for her consumer engagement and so on. It's quite cool. And my other sister, she doesn't work right now.
Okay, so
it kind of explains why trauma was so inviting to me from such a young age.
And did you yourself ever have to get treated as well for this, or was this just so normal part of life?
No, I had to. Just 2 years ago, I finally got diagnosed with ADHD. But before then, I was given different diagnoses. I was generalized anxiety disorder. But don't worry, all Lebanese are like this.
Wow.
We had, I had when my father passed away very suddenly during my master's program, and at that time they always encouraged you to go to therapy. So I was already looking for therapists in order to fill, part. It wasn't a requirement; it was a suggestion from the program we were in. So the therapist at that time diagnosed me with complicated grief. So she didn't call it PTSD, but it was a very, very sudden death of my father. I had to shop for therapists. I didn't like the first or the second or the third. The fourth one, I loved her. She used EMDR with me, and we only worked on my father's passing. So we didn't work on anything from what truly, I thought everyone experiences this. So I did not even bring up issues about war. I didn't even realize that it could be why I catastrophize so much and why I become anxious. And I masked my ADHD so well. As a child, I was very cute, but hyper, but very sweet, but naughty, like stuff like that. So it was all well hidden. These past 2 years, I had to go back and get I had to go back to therapy to learn how to manage my ADHD in a functional way and not result in anxiety and depression symptoms and so on. But yeah, with the EMDR, my first experience, I was just 21. That was when I first experienced EMDR, and it was amazing. And then, as I told you, like I focused my energy on ABA, so I kind of forgot all about EMDR until the recent years when I started realizing like can't just be talk therapy. Like there has to be other stuff we can do. Like this can't be it. And my sister was like, why don't you get yourself trained in EMDR? And I did. And now I'm pursuing a certification in it so I can become a consultant because I love it so much. I want to train others. Yeah.
So EMDR is weird. I also have a recent ADHD diagnosis, and thank you. Yeah. No, it's great. It's made such a huge difference in my life, and I've talked about a lot in the podcast and other places. The medication that I'm on has really dramatically reduced a lot of the symptoms and certainly made the things that I learned in therapy easier to do. And I'm starting to actually remember some of the stuff I learned in therapy because I don't think I was very good at paying attention in therapy, as you can imagine. And so, I definitely got. But there was I've got some skin picking problem, right? That I've had ever since I was like a child. And so the therapist recommended EMDR. Now this was during COVID. So there was no in-person, appointments or whatever. So she was doing EMDR over Zoom. And I'd heard of it, but I didn't know what it was at all. And then the next thing you know, I'm looking at this screen, and it looks like I'm looking at like a very old Atari video game, like Breakout or Pong or something. Like folks Google Pong. It's like the first ever video game that back in the 80s or something, or the 70s. Anyway, it's basically this ball that's kind of bouncing back and forth on this little rectangle, right? And so I think this particular screen had maybe a little grassy field and a little ball bouncing back and forth. And she basically said, okay, I want you to think about, she asked me kind of what, are some of the triggers or what are the kind of the first thoughts I have before I start to kind of, pick up my cuticles or whatever. And so I said this. Okay, think about those things and follow the dot. And I'm like, this is ridiculous. What are you doing to me? This is silly. And it also made me kind of nauseous, kind of just move my eyeballs back and forth over and over and over again.
I experienced that as well.
So I said, what is this ridiculousness that you're putting me through? I think I might have even said that. Like, how does this even work? And the therapist told me that, well, actually, we don't really know how it works. And so I'm like, was someone just playing Pong one day and suddenly the trauma of their lives disappeared? Like how did this even come about? So what do you know about EMDR as far as its origins and possibly what it's doing?
Do you have a certification with the International Behavior Analysis Organization, the Qualified Applied Behavior Analysis Credentialing Board, the Behavior Analyst Certification Board, or are certified through your region's Behavior Analyst Credentialing Board? You can earn continuing education units for this episode by going to www.behaviorspeak.com and clicking on CEUs. The first secret word is
So it is an absolutely absurd story. First of all, let me tell you, you're not alone. As I told, even when I went through it myself, I wasn't even out of a master's degree. I didn't even understand trauma properly. I haven't even met George Bonanno back then. Like I had no idea about anything. So I went in there really like just maybe not novice in mental health, but like just a little bit insightful. But one of the steps in the protocol of EMDR is it's an 8-phase protocol. And the first one, of course, is you take a history and so on. And they ask you all about your journey in life, because we believe that we have good seeds and bad seeds. Some seeds turn into weeds if not plucked, and some seeds turn into beautiful flowers. So we have good and bad things that happen to us, and it's all part of what makes us who we are today. So the second step is to actually explain right off the bat what we know about why EMDR works. You shouldn't have had to ask, but the story is very absurd. So I think it was 87, Francine Shapiro, who created EMDR, she was, I think, a grad student in California, and she was walking through a park. She had gotten some bad health news, and apparently she started following a leaf for like a couple of hours, looking at it, moving left and right, left and right. They call this saccadic movements, saccadic eye movements. And then she felt better about the topic. So the next few weeks, she kept trying, watching something, moving her eyes left and right, and thinking about something negative. And she found that she's becoming desensitized to it. So then she started it with her friend. So initially, after all of the research and the things, by her first book, I think was in 95, so like 8 years later, and it was called EMDR. So eye movement desensitization. There was no R yet. There was no reprocessing yet. Now, after all the further research and the further applications, like no longer just for upsetting events, but maybe upsetting thoughts, maybe body sensations. So they kind of expanded it much, much more with a lot of research. Then they added the reprocessing, because she realized that we actually work on reframing our thoughts from the negative thoughts. We try and strengthen the positive thoughts, the positive beliefs. We try and kind of make meaning out of loss. We do a lot of reprocessing. So that's where she was like, I wish I can even rename it, because further research showed that it's not necessarily eye movement. So I am exactly like you. I actually get very dizzy if I'm following something with my eyes. I have vertigo, so it triggers me immediately. What I was being told to do back in therapy was to tap as if there's butterfly wings on my shoulder. So it's called butterfly tapping. So it stimulates both sides of the brain, and it does the job. Or you can tap on your knees also, left, right, alternate. There's sounds that we can play. There's buzzers we can hold if we're in the same room, and it alternates. So there are several theories for why it works, and it's no longer just that it's eye movement where we're mimicking REM sleep. And REM sleep is when we do most of our processing and consolidating of day-to-day events. So there are several other theories. So one of the theories, and I do subscribe to the fact that eye movement does trigger something like REM sleep, because most of my patients, I would say 90%, would say that they have very vivid dreams the night that they have the EMDR. So after a session that day, they might feel even a bit tired. That night, they have very, very vivid dreams. So there is a lot of truth to that. But she's right. She was like, years later, decades later, they asked her, about the naming. And she said, I wish I can rename it and remove the fact that it's eye movement desensitization and call it dual attention stimulation. This is why there is a theory that when we're paying attention to two things at once, eventually one has to weaken. So if I'm telling you to pay attention to tapping on your chest or the dot or the sound or whatever, whilst we're talking about something that is normally very upsetting if we're just talking about it in vacuum, it is easier for our psyche to manage and to digest it and to desensitize from it. And then the questions that we ask you may be better tolerated. So we work within your window of tolerance and we expand it. So yes, it is absurd that there is no one theory why it works. There are several. So there is the fact that it's similar to the rapid eye movements. There's another theory of the working memory, where if you're paying attention to two things at once, eventually one of them has to give. There is also the fact that we try and activate both hemispheres at once while talking about one subject. So there might be things that were stuck or unprocessed, and probably because we have a hard time verbalizing them. And then when we are telling you to do something with alternating sides, either like butterfly tap on your chest by alternating sides, or tap on your knees, or listen to the sound in earphones so it alternates between ears, it could be that's why you get desensitized to something faster. So it is very frustrating that, and it's very absurd, first of all, how this came to be. It is upsetting that you can't really tell, but the thing is, we don't know enough about our brain, and we don't know why different people respond to it in different speeds. But the truth is, for the past 30 years, with all the research that has been done again and again and again, it shows that it does work. And it is very, very, for people who are very analytical and kind of want to know why, perhaps like you, like me for sure, especially because I was always like very interested in neuroscience. It frustrated me to no end in the first few training sessions. The question, and the clinician would say, I don't know, we don't know. And I'm like, well, then how are we doing something to people that we don't know about? She was like, well, we do have these 6 or 7 theories, and there is research to support each and every one of them. We just know it works. And then now, I recently watched a training. He's a brilliant trainer. He's a BCBA, I believe, and he talked about trauma-informed ABA. And he kind of dissed EMDR, and I wish I could reach into the screen and kind of tell him. He compared it to CBT. Like, CBT predates EMDR by 30 years. Like, you cannot compare the two. Of course, there's going to be a wealth of research behind CBT that compared to EMDR is not even comparable. But we're talking about something that was born in the early 90s, or late 80s. But proper research and documentation and all of that started from the 90s. With all of the brain is truly fascinating, with all the variety of mental health conditions to which you can apply EMDR. Yes, you may need to have all these theories to account for it, because honestly, I think just like with CBT, you have so many strategies. Same with EMDR. Like, I have many kids who I do EMDR with, of course, would never sit still and look at a screen or follow a sound. Like, they will get so bored. So we use like scribbling. So it's left and right scribbling, or I tell them to jump from left to right, and I put stuff for them. So we make it movement based. We make it like suitable for the client, but we're still doing dual attention stimulation. Aim for both hemispheres to be activated at once, with or without the eye movements, because really it's paying attention to 2 things at once that is the key. And I love EMDR because it treats, like, of course it treats PTSD for sure. That goes without saying, as one of the first and most well-documented things, that even if you go on EMDRIA, emdria.org, you can literally look at a button with the research, and it is around 34 pages worth of. I literally tried to print it once to give to a client. I thought it would be like 3 pages, 4 pages. I had a doctor who I was treating, so he wanted to know the evidence behind it and so on. And I was like, oh, my 34 pages, like that was like waste half my ink. So I never printed it, but you can see all the research, even stuff that the APA has published that puts for treatment of PTSD, for instance, or ERP, like specifically for phobias or something. It puts EMDR right up there with the best strategies, So I really have seen it firsthand, the benefit of it. I've experienced it. And yes, like, there are things that we have to do within EMDR. I don't know. I know this has to be behavior analytic discussion perhaps, or it's okay
No, it's totally okay. Yeah.
So, that we have 5 main trauma responses, right? So we have the fight, flight, freeze, fawn, and flop. So the fawn and the flop are a little bit less known.
What are they?
So fawn is when you people please. So let's say you have an attacker or a certain aggressor in a situation, or a certain threat in a certain situation that your body is perceiving as a threat, right? Start fawning over them. So you want to please them, you want to keep the peace, you want to do anything or give them anything as long as they just leave you alone. A flop is similar to freeze, but you actually like almost lose consciousness, or you almost completely collapse. And I've seen each of these in kids and adults that I've been working with, and in myself as well. Like, I know, like, sometimes if someone of authority is yelling at me, I might get very triggered. Or if I hear fireworks, or if I hear helicopters, like, I might get very triggered because I'll remember soldiers, or I'll remember war times. And I realize this, and of course, we have everything they teach you in CBT, like, or in ABA, like breathing techniques and cognitive reframing and all of that. But it just doesn't go away until you actually do enough desensitization to it. And ERP, yes, it's wonderful, or like systematic desensitization, as we know it better in ABA. Like, it's great, and I've used it, and I've seen great benefits to it. But it's just not as a holistic, like, not a comprehensive, approach to things. With EMDR, the 8 phases includes something, they don't call it psychoeducation, but it is something like psychoeducation. So they call it resourcing. So we make sure that the client has enough resources to cope with different events that might happen. We make sure that their window of tolerance is good enough. We make sure that we are well educated about their history. And then there is identification of the negative belief. What do you prefer to replace that with? So what positive belief would you like to put in place? What are the emotions and body sensations that come up for you? And we constantly check with the client. We give them a rating scale of 0 to 10. It's called the SUDS scale. So it's basically like a disturbance scale. And we have them, like I can even graph my sessions, just like I graph an ABA. But it is a subjective description of where they are at different points in the therapy. And sometimes things take 2 sessions, 3 sessions of actual processing, and you're done with it. And you start focusing on increasing the strength of the positive belief. So again, we measure it. So it's a validity of cognition, a scale of 1 to 7, 7 all the way through, 1 all the way false. And we keep working on it until they truly believe it, and all parts of them, So I start feeling like, for instance, I have a woman with a cat phobia, severe cat phobia. She came to me because she knows BCBA, and I said, yeah, I'm very happy, and I'm also well trained in ERP, and I can do this. But if you're willing, let's give EMDR a try. Within after 4 sessions of processing, she had 2 cats in her home, and she's the happiest.
Oh my gosh.
It is unbelievable. It is unbelievable. I just feel like if there's something out there that you can add to your toolkit, like, yes, it's not so well understood as well as other things. That's okay. I really just look at the effects of it, and I feel motivated every time. And when we get stuck, there are things that we call cognitive interweaves, or like basically questions. And it's similar to, how in CBT we put thoughts on trial, or in ABA we try and focus on certain parts of things, and we have like behavior activation targets and self-monitoring and self-management. It's very similar to that, but they are written in the language of EMDR. And it's up to you when the client gets stuck somewhere, or a session goes wayward or something. There are a lot of suggestions that you get in your EMDR training, and there's things that you can draw on from other disciplines. Like with me, for instance, I start questioning what's the function of this behavior. So if they can't let go of the pain, so what's the function of the pain? I had a client once tell me it became part of her identity. She doesn't know who she is without it, like flat out. She said, I really don't know who I am without it. And I was like, all right, so it gives you, there is a purpose. That's why you just can't let it go. So there is ways to bring in like internal family systems therapy, like parts work, we call it, or ACT or ABA into the EMDR, and at different phases, whether it's when we're doing all of this reprocessing, or even earlier when we're doing resourcing, as I call it, like we teach coping skills. And when I'm working with children, where it's much easier to be in charge of the session than when it's an adult and they have their own things to talk about, that I run that phase of EMDR the way I run an ABA session where I'm working on executive functioning skills, teaching them self-regulation. I literally take data, like how many times were they able to complete this? Were they able to do it independently? Are they able to self-monitor? So you can mix all 3 approaches in such a beautiful way that I'm just, as I told you, like that trainer, he's brilliant in so many ways, and I followed him for so long. But when he like kind of this EMDR, I'm like, oh, I thought I liked you. No, and I respect other people's opinions, but I don't know. I'm so passionate about it. See, because how I ramble about it even.
Yeah, no, for sure. That's awesome. And you talked about sort of the EMDR and the R being reprocessing or like reframing, and a lot of that sounds to me like ACT in there too. So
yeah.
I'm curious. I'm curious about that connection, about ACT and EMDR. How do they fit well together?
They fit so well. First of all, when I have clients that I feel are not fully on board, like they're not really all in when it comes to doing the therapy. And EMDR is hard. You have to sit with the discomfort and just learn to be okay with it. And yes, we're adding the dual attention stimulation. So it's a step further from just talk therapy and just a waiting game. It's a bit different than that. But they have to be willing, and they have to be all in. And I'm not gonna, talk about different parts in us that could be hesitant. That's a whole other tangent. But I then try and remind them of how this is a committed action that gets them closer to what they value, which is mental health, perhaps, better relationship with their family, or however, where, originally they come in with a concern, like, I can't connect with my sister, or I can't connect with my child, or I can't take it at work anymore. So there's normally a superficial concern like that. Not superficial that that's not valuable. I mean shallow. That's all they see at the surface. We look at so this is what you're looking at. So what are your values? That is one of the first things I ever do, just because I truly love values exercises. So I try and look at that as part of the goal setting. And then we try and use the fact that they're showing up for sessions and going through the EMDR processing and answering all these uncomfortable questions, sitting with the discomfort, doing all the work as a committed action to get them closer to these values. So first of all, that is the clearest link between the two. Second of all, there is the psychological flexibility that you need and that we try and focus on in ACT is something also that you need in EMDR. That is part of the window of tolerance. Like, you have to be able to realize that these thoughts are not going to go away. You can't erase your past. It's not like hypnosis that you might magically remember or forget something. Like, I know that's a mess too, but anyway, like I with EMDR, there's not even true informed consent. You have to just be willing to go through it and see what comes up for you. And if you don't have the psychological flexibility, then you might have roadblocks. So just like we do resourcing with EMDR, similarly we have to do with ACT. And the things that I choose when I'm doing resourcing with EMDR, I don't necessarily focus as much on, let's say, somatic symptoms or things like that, or breathing and things like that my counterparts would do, like someone who's solely practicing EMDR. I add to it things that are like reorienting yourself to the present, like the grounding exercises, things that are very common within ACT. So I just kind of have a bigger toolkit. It fits so well. And other phases in EMDR, like I told you, like when we get stuck somewhere with the client, I really do have to try and investigate the way I would if it's a normal ACT session. So I might use metaphors, I might use visuals that are very popular with ACT, and I might do the same in the EMDR session. So I would pause the processing for a little bit and like go and lean into where they're stuck. So the way I investigate is a bit different than someone who's solely trained in EMDR, because I have such a wider toolkit of things that work in ACT. And my favorite metaphor to use is the what is it called? The people on the bus metaphor, like the thoughts that are negative. Like I tell my clients, I'm not going to help you erase these thoughts. We can't erase the past. We can't undo something. What we can do is no longer be affected by them. So we can desensitize you to them and focus on the positive thoughts. So that's how they truly fit so beautifully together. And I'm very able to go without even the client noticing that I'm shifting techniques. Like, it's not like, okay, now I'm going to do this. It's not a very mutually exclusive. They fit in so well and seamlessly that it just is the way I formulate my questions. That's all. Really cool.
Really cool. Yeah, I mean, I love the idea of combining all three and in the work, and it does seem like it just all meshes really well together. So you kind of want to mostly focus on working with people who have trauma now, right?
Yeah, I mean, it's just because I have so much experience with neurodivergent population, special ed, the behavioral difficulties, that I feel like I would never say I mastered something. You can never be an expert in this field, but I feel like it is a strong suit of mine. So I was very interested in expanding to where I didn't get exposure. So it was just back when I was doing my practicum during uni. And even my practicum was split into two settings. It was a rehab facility and nursing home. It was back Staten Island. I think it was even bought out now by this corporate organization. It's been so long ago. But and another one was at NIPSI, where we did research. And so I didn't get the clinical feel except from that rehab facility, that nursing home. And it was with a very restricted population, TB, geriatric population, stroke recovery. So it was very, very nice. I liked it, but nothing like no trauma work. So I wasn't exposed to that. I personally in my life, yes, it was a lot that we, as I told you, it was part of the language, part of the vernacular everywhere I went growing up. So I was really attracted to that. That's why, like, in the past year, honestly, I didn't work full time on purpose, so that I can, every single week, I would finish a book on some new strategy or some therapy, or delve into some way of doing things, just so I can really feel like I well versed with when it comes to trauma, anxiety, depression, and all of that is very common and familiar to me. But trauma itself, yes, that's why I pursued the EMDR training, and now I'm pursuing the certification, because I was always like so interested in it. It's very applicable to me, and yeah, I just never got exposure to it clinically. So I went into this deep dive. Yeah.
Well, and also, I mean, just sort of from your literal birth until, pre-birth until sort of, some of the crazy stuff that's happening in the world right now. I mean, you've lived in places where I think folks on this side of the world just can't understand or relate to. And I think, and I'm not saying folks over here don't have trauma. I mean, I told you before we hit
Yeah.
record, I'm a firefighter. I mean, people are exposed to trauma for sure, but they're not exposed to, you know, unavoidable
Yeah.
trauma on a daily, intensive, lifelong basis, like
Yeah.
folks
Yeah.
in a lot of these Arab countries. And so it's something you said earlier when you were talking about getting your ADHD diagnosis, and I think you kind of just said it sort of off the cuff, but you said that, one of your friends said that, everyone in Lebanon has an anxiety disorder.
Yeah.
Is that just because everyone is traumatized sort of all the time in these countries?
Like, I don't have the statistics. I don't even know if we have the capacity to do these studies to try and figure out really the prevalence of it.
Yeah, yeah.
But I would like, it was, so in the EMDR training, we practice on each other in the trainings in front of the trainer. And there was this question where everyone said, no, no, no. It was a question where, have you ever had any experience with military combat, explosions, earthquakes, and so on? And everyone was from North America in the training. I was the only one who's Arab and who's not living in that area. And so I started giggling, and she was like, why? I was like, every single one of them. I have experienced every single one of them several times for a long time. Like, I don't even know where to start. She started saying, oh, this is what we would call a cluster. And she started explaining like how to approach it. And then now, yes, most of, no, I wouldn't say most, but like half of my client base is Lebanese. Now part of my intake kit is it's a tool that's called the Journey of Not So Good Experiences. So it's like a questionnaire, very typical or most common adverse events. And some of them are just, I can't stop listing, like when the Lebanese people are in the session, like it's uncanny. So I wouldn't say all, but I would say it's extremely prevalent. I don't know the number. I don't know if even we have the statistics for it. I'm sure I can find out. But it is just so upsetting that people have almost normalized it.
Yeah, it's interesting too that you talk about sort of, we talk a lot in North America about the ACEs, the adverse child experiences sort of scale or whatever. And have you experienced divorce? Have you experienced, abuse? Have you experienced poverty, divorce, and so on? And each one of those, and again, I could be butchering how the scale works, but essentially, as I understand it, the more of those things you have, the higher your score is, and the more likely, certain things are to kind of occur in your life. There's greater chance of disease, greater chance of suicide, greater chance of drug use, and so on and so forth. Greater chance of a lot of sort of problematic things kind of happening. But I'm wondering, kind of, maybe you don't know the answer to this, but how would a scale like that work? Because if you sort of got 1 point for being in a natural disaster or a war, do you get 10 points if you're in 10 wars?
I think this is where you're right. So that the ACE is lovely. It's great when you need something quick and you need something that's well known, so that if you're collaborating with other professionals, I may use it. But I definitely do not rely on it. And that is where, that's the strength of a clinician. When you're writing up a report or creating a differential diagnosis or doing all that work, like you have to go into the details. Like it is not right that, in my own lifetime, oh my God, I can't even count the number of explosions I've been near. And I've had it better than my friends. I lived in a mostly Christian area. I lived near embassies. So I was very safe, but I saw and heard everything. Like my now husband, back then he was my boyfriend, like he was displaced during the war. Like this is kind of vicarious experience as well. And the powerlessness that you feel, like that is also traumatizing. So yes, scales like this do not account for these areas. So now, for instance, we have a task force where we're trying to so I'm the president of the Association for Behavior Analysis in Lebanon. It's the chapter of IBAO affiliated with it. So we have a task force to try and support the people that are now experiencing all of this violence and conflict. And we have some people that are volunteering in Lebanon. We have other Arab practitioners who are joining this task force just like to support. So, for instance, we have someone on the West Bank, and I told her, like, hey, listen, I think I can facilitate group therapy sessions. What we want to do is we want to make it into community-based support group, because yes, we've been through similar things in Lebanon, but it's not the same thing. I've not been through a genocide. I don't know what it feels like to feel like my turn is next, you know? So I told her it would be more empowering for the community if we would teach you guys how to run your own support groups, empower you, and then we back off. So we were trying to do that, and then she just kind of asked me, like, I was showing her some of the things that even the WHO, Russ Harris, they've all collaborated. They've created lovely, lovely resources for the community. And she was like, this is all well and dandy, but this is going to be yes. Like, why even waste time? This is yes for everything. There's no post. You can't give me it. I know you can't. And I'm like, oh my God, it's so right. Even though I am from the region, I still, because I learned, and most things are written for the Western countries, and I've studied there, and that's where my training comes from. I still make that same mistake. Even I have to keep myself in check. Like, is this applicable? Is this sensitive? Am I gonna be almost insulting? Like, am I gonna be harming her by all of her answers are gonna be yes? She's gonna be feel like this is so helpless. Why even do the therapy? So we didn't end up pursuing this route where we have so many obstacles. Of the first one being the internet, but like we ended up honestly like. We had to adapt many things, and this has kind of even prompted us to try and think like maybe we should create our own questionnaires. And there are things adapted for the Arab world and for a violent stricken area, just not enough and not standardized enough, you know. There's a lot of work to be done for sure, and it takes the clinician to be strong enough to make that determination. But that's a brilliant question.
Yeah, so well, now that you brought it up, we're talking about. I mean, it's February 2024. We're talking about the war, and I don't really know where the war is, but the war between Israel and Palestine, essentially, and kind of all in that. I mean, I guess well, actually, a couple of months ago, it was all sort of in this sort of narrow kind of piece of land in the Middle East, but now I guess now it's kind of expanded beyond. Now we're seeing things happening kind of in Yemen and other countries, and you know, battles on the sea, and you know, and you know, who knows what this conversation will look like 3 months from now. But right now there's you know a lot of folks that are either you know dying, but there's a lot of folks seeing death. There's a lot of folks seeing horror, seeing things that I just can't even I can't even fathom. And I think and I think the media just gives you snapshots of sort of what's really going on there. And so in the midst of all of this craziness, you're saying there's actually therapists working like almost on the front lines per se with some of these folks. Is that what's going on? Like,
yeah. So who we were able to reach, like people from PCRF, people from Inara. We were trying to, even Dr. Ghassan Abu Sitta, I don't know if you saw him, but he was very active on social media, kind of documenting what was happening and advocating, because he was part of Inara as well. But to be honest, we had a hard time trying to reach and know how to help. So for example, Steve Soseby told us, get ready for the post, for when it's done, then we can meet, we can use your trainings, we can use your resources that you're creating in Arabic and individualizing for this conflict. I was able to reach someone, his name is, I believe, Ahmed Abu Rajela. Like they run, what is it called? On Instagram, you can find them as Shabab Gaza, which means the youth of Gaza. They are the ones who try and entertain all these children that are locked in areas, and they try and make the hot food and play games, and they're trying to do all this community work. I don't know much about them if they're actual therapists. So again, I reached out to them and I said, how can we help you? What do you need? No, we can't get physical things in for you. What else do you need? Like, how can we help you? And I told him, like, I have a team of everyone collaborating, from clinical psychologists to social psychologists to whatever you want, ABA professionals. He was like, I cannot even get on a proper phone call with you. I don't even have the resources to even have a chat with you, to even raise awareness about this. Like, thank you, but no thank you. So like at first we were so heartbroken. And then we were able to find some of our colleagues, some of ABA practitioners in the West Bank, some who have family in Gaza. And we started asking them, like, what do you need? Like, how can we help? And they said, now most of the centers that used to give ABA therapy are closed, or any education are closed. The school year is short. we need some resources to empower the families, to teach them how to cope, to teach the students how to make up for lost time, to know how to express themselves, despite if they're neurotypical or neurodivergent. Sorry, whether they're neurotypical or neurodivergent. We started we broke ourselves up in the task force into different groups, whoever has the scope of competence. We're mostly focusing on creating resources and trainings in Arabic, in the Levantine accent, so that it's suitable. And we're making sure to record things from scratch and write things from scratch, because we don't want to kind of give them something that was designed where we ask parents, go ahead and go buy that and go do this and create this, when we know you can't. Like, that would be almost insulting. So we're doing it all from scratch, which is why it takes a bit of time. And part of this endeavor is to raise awareness to the trauma that's going on, and how different clinicians and different, even social psychologists and political psychologists can help us give insight into making sense of this injustice and this response that we're all having. Like, there was around 2 months where, for real, I couldn't catch 6 hours of sleep even straight. Like, I would wake up on the hour every hour just to check my phone. Like, and I'm not even in the region. So we're trying to, pull our resources, see how we can help. But apart from creating trainings and basically training the trainers, and then they go into the communities and the camps to train the families, to empower them, we tried to offer as many resources that we can that, as I said, are individualized and in their even dialect. But we face a lot of obstacles. We do, even with the individuals who are volunteers. There's sicknesses, there's rampant, they can't get medicine easily, so we have like people dropping out. So we're facing obstacles left and right, but it's better than not doing anything. I'm sure anyone who looks at something, and especially the linked faith component, like they look and walk and talk like me, maybe even the people in South Lebanon, like all of them have been displaced. They're all in Beirut. Schools are closed, centers are closed. You feel just so powerless and helpless that you feel like you are immobile, paralyzed with the survivor's guilt. So I like this task force. Yes, it's slow moving, but we have also very limited capacity with what we can do, but we are doing something, and we're trying to make it as sensitive and responsive as possible to what's happening. But I truly cannot believe, I think we're on day 122, I think, correct me if I'm wrong, but it is just, my brain just cannot handle it anymore. Half my clients are either in areas that are in danger or are fleeing, and everyone is like, how is the rest of the world operating? Like, tell us. Like, they're truly almost looking at me with this kind of cocked head, like, how are people not constantly talking about this? This is everything we are living and breathing, and this is all we think about. How can other people just be able to move on? And I have to tell them it is mainly a human coping strategy. You have to. We can't. We're so helpless and powerless. The next best thing is to try and shut it out sometimes. It is just very painful for everyone involved.
Wow, super heavy. And also I was talking, I had this was in December, I had Dr. Bahar Amini on, and she's Iranian psychologist in the States. And she was talking a lot about the work she's been doing, or her and her colleagues, and there's the Arab MENA psychologist group. I don't know if you're familiar with them. It's kind of like one of these special interest groups. It's called the Arab MENA, Arab MENA, Middle East North African Psychologist sort of association. It's sort of a division, I think, of the APA, and really encouraging anyone around the world that's Arab in any of these fields to join, because she was talking about how there's a real need as well, to support the clinicians themselves that are either, I think in your context, there, these are clinicians that are literally, probably fearing for their lives in some context. Whereas I think she was talking more about, similarly, I think fearing for their lives. She was talking about sort of, particularly like Palestinian American, psychologists and whatnot that are, dealing with, racism and hate and all those sorts of things in North America, and sort of, anti Islamophobia and the like, and trying to kind of build supports for clinicians over there. Has there been any kind of work there or conversation there around sort of how to, even support the clinicians themselves?
The second secret word is trauma.
Yeah, we're preparing a webinar, a 2-part free webinar. Even we're offering CEUs. So again, it's part of this task force, and something ABAL is always interested in trying to do, which is to enhance the growth of therapists. So this one is dedicated. We haven't actually figured out the title of it, although it's just in 10 days, the first part. So it's with a developmental and trauma therapist in Canada, but she's Lebanese. And another one is an educational psychologist in the UAE, but she's also Lebanese. So they're basically who we're interviewing, but it's going to be a webinar with the PowerPoint and all the literature involved to back it up. And the focus of it is to how to be your best self, basically, as a therapist when you are experiencing difficult life circumstances, such as what we're going through right now. This is going to be directed to therapists, and we'll talk about mindfulness a little bit. We'll talk about the trauma response. We'll talk about compartmentalization, the difference between compassion and empathy, and how, you know, you don't have to absorb what your client is going through and how to stop that from happening. The mind attitudes, basically, that you should have. So as part of the Association for Behavior Analysis in Lebanon, myself and another member are interviewing these two therapists after they present their side and their experience and their literature, and to translate it into ABA language, basically, like how does it apply to the ABA field, just so that it's kind of an interdisciplinary talk, and that it applies to everyone who works with anyone in a therapeutic setting or even a special education setting. I know a lot of the times we take our work home with us, and it's just it's not easy to. You're just human. Sometimes it's not easy to stop thinking of it, especially when it's someone that you have a linked faith with. So so we are truly, it's coming up in around 10 days, the first part, and then after that, a week later, the second part. And it is dedicated just for this, but I'm thrilled to hear about this group that you mentioned. I'll reach out to them and I'll let them know that we're doing this, because it's going to be delivered in English, but with Arabic translations, live captions. So, and again, we're all Arab, but we've all practiced everywhere. So it will be flexible enough to suit someone who's attending from the US. And who knows, maybe they'll let us join them as well. And we can collaborate. I think that's very brilliant. So thank you so much.
Oh yeah, no, I'll send you the info. I'll share the info when we're done. Obviously, I'll put the show notes and stuff too. No, she really was. One of the questions I had for her was about sort of, you know, even like can like Arab behavior analysts join, and she said yes, everybody please. It's a relatively new group as I understand it, and so and of course she was talking. This is a bit of an aside, but she was sort of talking about kind of how they're especially needed in the US, because in the US, Arab and Middle Eastern people are not counted in the census. And so they're actually counted as white people in the census.
I always just smile when there's the word other. I'm like, I am other, I'm other.
Yeah, exactly. And apparently this goes, you know, beyond the census to some other sort of, you know, political entity and whatnot, but you know, again, just speaking to kind of structural and systemic racism and so on and so forth. But you know, there really is a need for a lot of support. I wanted to kind of go back a bit to Lebanon and ABA Lebanon and kind of some of the work that's happening there. I mean, I had Rola.
I know. I heard her
a while back, and you know,
she's the one running those webinars with me. She's that board member.
Lovely. Good. Hello, Rola. Okay.
She has a lovely combination of skills as well.
It really does. That's so awesome. I was wondering, because she does a lot with mindfulness and whatnot, and so that makes sense that all kind of fits in there. And and I think at one point she was also the president, right? And and she and I encourage folks to check out episode 94 with her, because we won't get into this today, but she shares a lot about some of the history of in Lebanon and the many tragedies that have occurred there, from the October Revolution, the Beirut explosion in 2020, and other things like that, and sort of some of the history there. But so we're about 30 or so episodes later. What else has been happening with ABA Lebanon? Like, how many members do you have, and what kind of work's being done?
So members, we realized that the fees, we had a small fee, but it was still a fee. So it was stopping people from enrolling. So we now waived the fees. So now we have over 100 members. We were around 25 before we waived the fees. We're trying as much as we can to empower the community. We just ran a conference in October. We brought speakers from the US. they're ABA and speech practitioners, speech therapy, practitioners. And the topic was ABA across the lifespan. So my part I talked about, because that was my passion in ABA, and it's working with adolescents and adults. So transitioning into adulthood, basically, and adolescence. And we were able to bring up topics like sexual education for for SEN population, and it was amazing. We also are trying to, so with this task force, it kind of preoccupied us. We were very ready to start planning the conference for 2024, which is probably going to be in October. And we were all for like making it into ABA in all settings, like how can ABA be applied in the workplace or in school or so on and so forth. But it's all kind of, we put a pin in it when the events started happening in October. And since then, we feel we had so many ideas of like empowering the community, telling parents like what to expect from your service provider, what is ABA standards of practice, like to make sure everything is being done with fidelity and with integrity. But we had to kind of put a pin in all of that, because honestly, we felt it would be insensitive. We know South Lebanon is being bombed on the daily, and next door we have a genocide. And then for us to be like, does your ABA practitioner do this? So we felt it was weird. It's been 122 days. So we're moving along. We're forcing ourselves to still, still people need the support. So we're trying to engage the community. So we have this network now where we have a community on WhatsApp. It's this text messaging app that's very famous in our country. So to try and share articles and things that are applicable, we're trying our best to where we might actually make trauma and trauma-informed therapy as topics of the upcoming conference, but we're still unsure. But I think that would be very relevant and very important. Yeah, we have several things on the burner, and we're also making sure that we are empowering, and we're even trying to sponsor people to get certified at different levels. We're trying to even collaborate with other chapters. Even some in the US have expressed interest in what we're trying to do. They see like we have an underserved community, so they give us some of their experience. So it's really very nice collaboration. But yeah, that's what we've been trying to do. The financial situation, unfortunately, is still the same. Things are crazy because you can only use dollar now. Can you believe it? We use US dollar daily, but not exclusively now. Otherwise, you have to have like a whole suitcase of lira to be able to pay with the Lebanese. So yeah, but I mean, I hate to use this word, but the Lebanese are resilient, and they figured out a way to cope and live, and figured out sources of income, and figure out different ways to fund different things. But there is just a huge disparity, as I was mentioning, I think, before we started all this, like we don't have a middle class properly anymore. You're properly well off and you have funding from someone outside of Lebanon, or you're really just struggling to make ends meet. So we have to be very careful with that when we offer CEUs, or if we offer any suggestion for certifications. We have to offer routes and resources that are free or accessible. Take care of the people who need it. Make sure that they get what they need.
Well, and just also wondering, so you said they're bombing in south of Lebanon. Is that part of this current conflict?
Yeah. So there is a party in Lebanon, a political party called Hezbollah. So they are, as far as the US is concerned, they're the terrorist group, but their sole purpose is for what they call the Arab cause. So that is to liberate the occupied territories or so on from Israel. That's as far as I understand it. I don't know if I ever shared this with you, but as a coping strategy, I used to not look at anything that has to do with current affairs or politics, because it would be such a trigger to me. As others are, but so Hezbollah, in reaction to what happened after October 7, in reaction, they started fighting, and Israel is constantly threatening to expand. So like my family, who don't live in South Lebanon, they live in Beirut, and in the north, they hear Israeli helicopters, and everyone is like, even them telling me this made me want to bawl, because my nieces and nephews are like kind of reliving what I lived through, just waiting. So we're constantly being threatened that if you don't stop, we will expand, and it's extremely scary because it's a very real threat. And for me, it doesn't seem like uninstigated, because we were being also bombed. They're even dropping phosphorus on South Lebanon, like on villages, not even on military areas. But as far as the Israeli side is, they think it's uninstigated, so that it's not, they shouldn't be involved. But I don't think the Lebanese, not the Lebanese army, the Hezbollah, I don't think they saw it as an option even. It is very heartbreaking for me, because on the one hand, I know, many people are cheering on the Yemeni Houthis because they're fighting or trying to do something. Just like part of us are cheering on Hezbollah, even though, yes, we would wish things were stable and at peace, but we want to do something for Gaza, right? But then we're like, but what about us? Like, can the Lebanese economy even take another war? Like, can the people withstand another war? I really do think that there is a form of dissociation day to day. Like, you would even see people partying at this time now. Like, you would see them having the time of their life, the best nightlife, the top restaurants, like 5-star dining, 5-star experiences. And I'm like, where are you guys living? And then my mom, who lives in Lebanon, is like, Sawsan, they have to dissociate from what's happening. Otherwise they can't survive it. And then I stopped passing judgment, because I'm not living in Lebanon, so I have a luxury to pass judgment, I guess. Yeah.
Is Lebanon a place where refugees from all of this are coming, or?
Absolutely. Oh my God, even from Syria. We have a huge population. We're so overcrowded. It is unbelievable. My mom, when all of this started, I told you we don't necessarily live in an area that has any combat, but I was just scared for her. She's an old woman. She lives alone. So I was like, Mom, please leave. She said, no, they'll take my house. And this is so triggered by several things. It's triggered by the fact that there are so many refugees without homes, that if they see an empty home, they'll take it. And it's also triggered by the settler colonialism, the fear that she has instilled in her, that she truly, truly believes that her home, even though we live, as I told you, in an area that has nothing to do with Hezbollah, so far away, it's not even funny, that she has this genuine fear, and she just cannot get rid of it. And everyone tells me, Sawsan, it's a real fear. There's so much poverty that if they see an empty house, they'll just take it. My heart breaks. Like, a part of my volunteer work back in college, when I was still in Lebanon, was in refugee camps. At that time, there were Palestinian refugee camps, not Syrian, nothing like that. The Syrian war hadn't even started back when I was living there. But the immense amount of refugee camps, it is unbelievable. There's a whole chapter of funds that are meant for Palestinian that actually goes to these refugee camps, even though they're on Lebanese land. This is how big it is. So for me, when I see posts or tweets like, why don't the Arab countries take the Palestinians? So first of all, they shouldn't be having to leave their home. But even so, we already did. There's no more. They are not even living in good conditions anymore, the Syrian or the Palestinian. It is just so heartbreaking. I have so many friends who reached university, but they were living in refugee camps. So by the time they reached university, I wouldn't know where they came from, just like they don't know where I came from. We're all in Beirut. It's a huge campus. And then they would be like, oh yeah, this is how we were living. We had the rations, and I'm like, oh my God, this is horrifying. The level of need and the amount of refugees, Lebanon cannot take more physically. And it's just heartbreaking, because no one is going to close the door and say, don't come in. No one would. As much as Lebanese, they would say, we're overpopulated, yes, refugees and so on. And there's even political parties that argue about naturalization and, making them nationals. And it's a whole other ordeal. But at the end of the day, no one would close their doors and turn away a refugee, but we shouldn't have to do that. That's where we stand. Same, and I think with Egypt has the same political point of view. Like, we shouldn't have to keep opening our doors for they shouldn't have to leave their homes, full stop. Like, it's not that we don't want to take them, not at all. Yeah, so it's just very, very unjust. And I think as a trauma survivor and someone with ADHD, the injustice sensitivity is just, honestly, some days I just can't take it. I find myself grinding my teeth just by scrolling on Instagram. Like, I cannot control the upset. Yeah.
Because I also wondered about, and I mean, you're doing so much already, and you got so much on your plate, but you sound like someone who would happily add more to your plate. About the kind of work maybe you're doing now, the kind of work maybe this conference might bring, and the kind of work you've done in the past around Has that also been applied to supporting refugees?
Yes, now we look at for volunteers and practitioners who are able to either train trainers or themselves go into refugee camps. But there are already entities, frankly, in Lebanon that are mental health oriented and that they do this work. And it's because it's been such a long standing. I know I wasn't even the one who came up with the idea to do this volunteer work. It is just advertised everywhere. It is that much of a common thing and
Right.
that much of a need that they even let student level volunteers come in and support with community-based mental health support. So that's what we used to do. Even my sister did the same thing. And we have these organizations that are, honestly, they're very, very active in Lebanon for different things. So it has to do with domestic abuse, but it is provided for anyone in Lebanon as well as people inside the refugee camps, because it is a different type of support that will be needed in those areas. So there is a lot of work, and it's all without government funding. If I know correctly, we wouldn't even dream of it. The government is so corrupt anyway. We wouldn't even expect funding. So it's all being done by donations, by volunteer work. Fundraising that is completely has nothing to do with the government. So there is definitely this task force. If we are presented with someone who can enter these refugee camps in a new area. That's why even we kept the topic vague, the title of the task force vague. It's on our website. We kept it vague because we want it to be lasting. We were hoping for a ceasefire soon, and we want this task force and this collaboration with other practitioners to continue for any time there might be a crisis. Like the last time a group of therapists banded like this was back in when there was earthquakes last year. So again, they did social stories for kids to explain all of what's happening. And the earthquakes was all around Syria, Turkey, and Lebanon. So it was extremely terrifying and very, very massive. So again, therapists banded. So this is not new, and I do not want it to stop. If I would leave a legacy as the president of behavior analysis in Lebanon, it would be for this task force to be vibrant and continuously adding. So yeah, for sure, if we can reach these refugee camps consistently, I would be so happy.
I'm also thinking about all the first responders that are there that, literally, digging people out of rubble and carrying bodies day after day after day. Have you or any folks in your group had experience kind of working with those folks too?
To be honest with you, no, but the trainer who trained me in EMDR is a therapist for first responders. So she was sharing her work, and I was just floored because I have some of my best friends who are paramedics and who are volunteer firefighters and who are still in Lebanon. So they were there, for instance, at the August 2020 explosion. It had nothing to do with war. If anyone is listening and they're not aware of it, it was the second largest non-nuclear explosion that has ever happened. It was so heartbreaking that people are being treated in parking lots on the street. So I just asked my friends, like, how did you cope? And they're like, we had to completely become robots, shut down our emotions and work. Like, I think there's such a need. And this is why I'm trying to get my full license as a mental health clinician so that I can then, separate from ABAL, I think it a little bit exceeds the resources of ABAL, but I would love to participate in running groups for first responders. I think this is such a need and very underserved, for sure. Nothing even comes to mind of something set up. I'm sure there are, but I can't even think of it.
No, I'm just curious. Kind of circling back to ABAL and circling back to the task force, the sort of the vaguely named task force, so it will last a while. What are some things? I mean, I imagine most of the folks that will be listening to this interview, probably won't be in these Arab countries. There may be a couple here and there, but a lot of them will probably be, North Americans and sort of folks that are maybe a little more removed from here, but also folks that are, connected to ABA, connected to ABAI, and so on. What are some of the things you kind of want these folks to know? How can folks help from the outside?
How can they help? To be honest with you, this question was once posed in a different context completely. And there was such backlash from people who are opposing. So I want to be careful with how I phrase this. Who don't believe this is a genocide? Who believe this is pure self-defense?
I get what you're saying. How dare we even offer to help?
That was truly worded in an email and a SIG that I was part of. That was truly written. And I could not sleep or eat for 2 days because I could not even muster the words to respond to such a statement. Because for me, I mourned the victims of October 7. It's just like I am mourning everyone now. Human life is a human life, especially if they're civilians. And so, yes, we can try and put context and we can try as much as we can to explain everything, but there's so much cognitive dissonance. There's just, it's almost, you feel so powerless. And so the first thing I can say is just, at least if you find an endeavor like this, don't criticize it, don't attack it, don't try and there are some that are so gung-ho actually that actually criticized us for not putting the word Palestine in the title. And I said, well, I am so scared of getting sanctioned as ABAL from chapters that are perhaps not in line with us, that will accuse us of being politically oriented and so on. And I said, I have responsibilities, I have certain liabilities as well. So we had to be careful, and we got criticized. So the first thing I would say is don't criticize and don't attack. Like what we're doing, look at the call to action. What am I doing? What am I doing is I'm offering humanitarian support in the form of training and resources right now, hopefully in the form of empowering the community. It doesn't matter who. So for me, I think I would just ask for mental health clinicians to be a bit more wise and compassionate when they are presented with such an endeavor in front of them. There are many like us. I remember I was in a sick group, and there was once a person who said, as mental health clinicians, I mourned the psychologist who was killed. It was just 2 weeks ago, and the backlash on that listserv, I was just floored. I was like, we cannot even mourn? Like, who are you to tell me who I can mourn? And the call to action was things like, pool resources in order to see, like, similar to things that are dedicated for certain groups, so that it is culturally responsive and sensitive to the times. So there wasn't any accusation, no threat, but immediately the backlash was so big. For us in ABAL, generally, yes, we have a page where you can give us donations and we can outline like how we use your money. But if this is for this particular task force, we're very scared when it comes to fundraising, because we're still not certain how to get the resources there physically. And we're all volunteers. So it's not like I'm covering the salary of anyone, you know? So monetarily right now, I would advise, if anyone is inspired or at least interested in what we're doing or wants to support it, I would ask them to support who we support, which is endeavors like HEAL, HEAL, by the founder, the founder of PCRF, the Palestinian Children Relief Fund. He kind of created this association because he really wants to focus on the mental health healing as well. So you can donate there, you can donate on Inara. I'm a bit worried to say, oh yes, donate to ABAL, when I don't know still how to get the money to the people there. Like, we've contacted people, they said that the ATMs don't work regularly. We can't, even if you do send us money, what can we do with it? And we were thinking of creating kits, educational kits, including toys, like stuff that we would use for coping. And then we were like, got so excited. And then someone who lives on the West Bank, she's like, and how will you get all those to us? Even people in the West Bank cannot reach their family members in Gaza. Like, it is so limited that I would be really very cautious about asking for donations now, because we don't have the capacity like a huge organization such as PCRF, HEAL, or Inara would. Inara does do a lot of mental health work. They even have a rapid relief fund for Gaza, and they're able to save and to activate and make sure the donation reaches the people who need it. But I think just kindness, just be kind, be understanding, realize that, you know, I have she's a psychologist. She's extremely active about the Palestinian cause on Instagram, and she kind of wasn't very happy that I told her, please, like, when we do a webinar in the future with you, we have to be careful with how much we can talk about what's happening. And she was like, why? You can't censor? And I'm like, but I'm not hosting as Sawsan, I'm hosting as ABAL. We're all in different countries. We have some people on the West Bank who are terrified of being associated with anything that has to do with quote unquote pro-Palestinian. People are literally in danger sometimes. So just be careful, be kind. Just like I forced myself to be kind. Like, there was a response to one of those emails that I was telling you about, and he said, you want to talk about fear? It's when he's the Israeli chapter, and he was like, hey, when I'm walking down the street and we hear, and I have to duck down for cover, and I have to lie down over my children, and I started crying. Yes, he is a quote unquote on the opposite side, but he's human, and he is experiencing the same thing. It is so scary and very sad, and I have the emotional and cognitive breadth to accept that this is his position, and I'll respect it. But yes, when there is then verbal aggression, and I responded as such, and I told him, I am very compassionate with what you're going through. I've been through that too. It's very, very scary, but we should just look at the call to action, like in that email, you know? So it was, I think that's all we can ask. Compassion, and some understanding and encouragement, I think, if possible. But yeah, that's all we can expect and ask people. Kindness, yeah.
Yeah. Well, Sawsan, thanks for coming on and talking to me.
The third secret word is hope.
This was awesome. Thank you. It's an honor for me to be here. I followed you for quite a while. I honestly, I hope that my ADHD didn't make me ramble too much, but when you mix in what I'm passionate about, you can't get me to stop talking. But thank you so much.
ADHers are my favorite guests because
awesome.
Yeah, so happy to have you. Thanks again.
All right, thank you. And for anyone listening, I really hope that I didn't say anything that offends anyone. It was never my intention. I have nothing but empathy and compassion to anyone who's facing any mental health issue or any life circumstance that could be adverse. So I really hope that in no way was I insensitive or did I hurt anyone or offend anyone. Put that as a disclaimer.
Well said. Thanks again, Sawsan.
Thank you so much for having me, Ben. Take care.
Check out these related episodes of Behavior Speak. Episode 94, Behavior Analysis in Lebanon and Qatar with Rola El Anan. Episode 124, Unveiling Narratives, Navigating Challenges, Embracing Strengths, and Increasing the Visibility of Arab MENA Psychologists with Bahor Mamini. And episode 200, Safeguarding Vulnerable Children in the Arab World with Asman Salih Khalil. You can find us on Instagram and TikTok and subscribe to our YouTube page at Behavior Speak. And if you enjoyed this episode, please leave us a review on Apple Podcasts or Spotify.